Hi, I'm Dr. Aniruddha from Toothpicks Dental Healthcare. I'm a director and a dental surgeon at Toothpicks Dental Healthcare, 4th Block, Jayanagar, Bangalore. Oral cancer can result in a very devastating condition for the patient post treatment or because of the problem itself. So what is cancer is what we need to understand. How cancer is formed, why cancer is formed. Of course, considering all that understood, now when we talk about the kind of replacement that we do after oral cancer, generally during oral cancer there are surgical incisions, surgical excisions of certain parts of the face, parts of the jaw. There can be a patient with no lower jaw, or maybe the maxilla is removed, maybe all his teeth is removed and things like that. But after that, when he recovers, he has a full life ahead of him to have food, to chew food for the aesthetic reasons. So all the things that we have taken for granted all these years, thinking that it is all normal and things like that, becomes very important and vital things that will actually function in our body. With a kind of discussion with an oral surgeon who has done surgery for cancer, a prosthodontist, that is a replacement dentist, and the dentist who is involved in the treatment of the patient will come into a kind of treatment plan where we could anchor certain areas to support the dentures that we need to place for the patient. So it's not contraindicated, or it is not that it is not possible to place a denture after oral cancer and its treatment, but it has to be assessed clinically. The extent of loss needs to be assessed. Depending upon all these things and depending upon the systemic health of the patient, depending upon the stage of treatment, depending upon the stage of cancer that the patient is in, we will have to try to get and develop a treatment plan for the patient individually. So therefore, whichever state, it is not that it cannot be placed, but it has to be clinically evaluated first. If it is clinically evaluated, definitely there is going to be some solution for most of the things that has been lost in the facial region.